Hi, my name is Caitlin. I'm a nurse practitioner student here to ask you some questions and perform an exam. Can you tell me what brought you in today? Well, based on those symptoms you're describing, such as abdominal cramping, nausea, vomiting, decreased appetite, and inability to pass gas or stool, I think you have a bowel obstruction. And what that is your small or your large intestines become blocked. So this could be a mechanical or a non-mechanical cause. So mechanical causes would be a surgery that left adhesions or a diagnosis of diverticulitis or tumor. And a non-mechanical cause would be when your nerves or your muscles in the intestines impair your digestion. And this is known as a paralytic ileus. So the elderly population are at an increased risk for this, and that's due to their slowed peristalsis, which is involuntary movement of the intestines, and their lack of exercise, their decreased muscle tone, and inadequate fluid intake. And you being 72 years old, you're at a higher risk. Okay, so this is about 1.5 per 100,000 patients per year in the US. And two differential diagnoses I've come up with based on your presentation today are intestinal perforation and a pseudo obstruction, also known as Ogilvie syndrome. So we'll do some diagnostic tests, and that includes some blood work, which is checking your liver and your kidneys and your electrolytes and your blood counts. And I'll also be doing an abdominal exam, and I'll check for tenderness and absent bowel sounds, okay? So first I'm going to inspect, then I'm going to auscultate, which is listen, then I'm going to percuss and palpate, okay? So after that, we will get an x-ray and a CT to see if we see any blockage, and hopefully we'll have some more definite answers for you by then. So until then, you can just increase your fluid intake, you can decrease your portion size for your meals, and you can make sure you chew your food thoroughly. Also, I have some pictures here I drew on the exam paper, and this is to further explain what we're talking about. So this will be your normal bowel. This would be a large bowel obstruction. This would be the pseudo obstruction. And lastly, you have your small bowel obstruction. So I hope this helped you today, and I hope we get you feeling better soon. Thank you.